start out with saying if there is anyone in the room who I have not met, but I believe I do know everyone. But anyway, I'm Diane Knight, and I coordinate the Tobacco-Free Community Partnership, which is a program of Greater Lawrence Family Health Center. So welcome to the Ex-Smokers Hall of Fame. This is our kickoff reception, and I want to thank all of you for coming and taking the time this afternoon to be here with us as we celebrate the ex-smokers at the Health Center. Our program today will be brief. It will consist of Dr. James Myers, who will have a few words for us. He is a family practice physician here at the Health Center for how long?
Wow.
Many years. Many years, and a great supporter of tobacco cessation here at Greater Lawrence. Also, Pat Conway is the Director of Nursing Practice here at the Health Center and will share her quit story. And after that, I would like to recognize the ex-smokers. There are 3 Health Center patients that we've had really the honor of interviewing and who are a part of this program. And there are also 8 Health Center staff who have very willingly stepped forward and been willing to share their story in the hope that it would inspire other smokers in the health center or in the community to make a quit attempt. So thank you for sharing or taking a look at the display boards, which will give you snippets of what their stories are about. But it was truly an honor to listen to the heartfelt words of the ex-smokers that we listened to. And it was very, very inspiring and very touching for me to hear them. So I really appreciate everyone who participated. So I thank you very much for that. So without further ado, I would like to introduce to you Dr. Myers. He's done a lot here at the Health Center to help us track and monitor smokers and their status in smoking, and so that we can better serve their needs around helping them to quit. So I really thank you for your support and being willing to speak.
Hi, everybody. I know a lot of people here, not everybody. I'm James Myers. I used to be a resident here, and then I've been an attending physician for about the last 4 years. And this kind of fell to me because we were involved in a tobacco cessation grant for about 3 years where we tried to improve our infrastructure, tracking smokers, trying to figure out stage of change model, where people were, trying to change processes in this big organization. It's like steering a cruise ship, you know. And it's been an interesting project. It's not going on currently because a lot of this money kind of disappeared as the economy went south. But we're still getting some of the benefits of it. But I just want to say welcome to everybody. It's an honor to be here. This is amazing when I look over here. When we look at kind of the global health outlook angle on tobacco, I know everybody's so used to hearing statistics, but every time I read the literature, there's more studies and there's just more and more out there on what this phenomenon of smoking is doing to the health of the world. It's we've known for years it's the #1 preventable cause of illness and death in the country. #1 preventable cause, and that includes in our community. There are 400,000 people, they estimate, die of tobacco-related causes just in this country every year, and that's that's a lot of people. I actually read something recently. There's a new study done in kind of a global health outlook, which actually uses statistical analysis and predicts that lifelong smokers, if you look at it country by country, lifelong smokers are as likely to die from a tobacco-related cause as they are to die from all other causes combined. Imagine that. tobacco kills this many people, and an equal number of people die from, from all other causes combined. And that's how likely they are to die of a tobacco-related cause, so long as they continue to smoke. That's astonishing. We die from, everyone thinks about lung cancer and lung disease, but also tobacco speeds up atherosclerosis, which causes blockage of arteries to the heart. People have heart attacks, people have strokes, become paralyzed, they die of all other kinds of causes, as well as other cancers such as bladder cancer, breast cancer, endometrial cancer, cervical cancer. All these rates go up, hugely. Prostate cancer with tobacco users. So, whenever I read this, 400,000 deaths, I'm like, how many people is 400,000 people? I don't know, that's like a lot of people, right? But there's millions of people in the country. So, I pulled out my calculator. This translates to 100 people in this town dying every year. 100 people in Lawrence dying of tobacco-related causes every year. That's like 2 people dying every week, And that's, I think about this. If there was a serial killer in Lawrence that was shooting 2 people every week, every single week, 2 more victims were picked off, unexpectedly, what would be going on in this town right now? We wouldn't leave our houses, right? We'd be boarding up the windows. No. And why? Because we have the idea, we believe that getting shot by a serial killer is a preventable death, right? I don't leave my house, I don't get shot by a serial killer. Preventable, right? But tobacco death is completely preventable. At least in theory, it's completely preventable. You stop smoking, you don't die of tobacco-related causes. So it's a complicated thing, Obviously, we don't see it quite that simply. In Lawrence, the data we're collecting here shows that about 19% of people age 18 and older who come to the clinic smoke. And this means out of people over like a 1-year period who are seen once or more at the clinic, 19% of all unique patients whose smoking status were identified themselves as current smokers. And that's right in line with state averages and national averages. However, if you ask their physicians to estimate where they are in the process of quitting, like they're not interested in quitting, they're contemplating it, they're getting ready to make a change, they're actively making a change, you'll find that 60% of these people will be identified as in some stage of change, at least considering quitting, all the way up to trying to quit and having recently quit, right? If you look at national surveys, they show that if you ask all smokers, would you like to quit if you could, 70% at any given time will say yes. And something like over 50% will say they've tried to quit or cut down in the past year, And how many of those people actually quit? If you take somebody who's making a quit attempt, all comers quitting in all different ways, and you check long term, like a year later, how many have quit? 3%, maybe 5%, 1 out of 20, 1 out of 30 people. So the rate isn't so good, which makes this all the more amazing that we have 10 long-term quitters that are, is it 10? 11? Oh no, I see that one. This could be you. That's number 11. It could have been me, actually. I'm not a smoker. I'm sorry. It makes it that more amazing. And, we ask ourselves as clinicians, like, what makes the difference? Is it just the willpower of people? Until someone is ready to quit, willpower doesn't seem to have, someone's willpower with respect to other things doesn't seem to correlate to how easy it is to